going to talk about COPD and the medications used to treat COPD. What is COPD? COPD stands for chronic obstructive pulmonary disease. It isn't one single condition. The term COPD covers a few different problems. Chronic bronchitis is inflammation and swelling of the airway passages, the bronchi. The inflammation narrows the space for the air to get through. In addition, when you have bronchitis, excess mucus or phlegm is produced, narrowing the space more. You therefore can experience shortness of breath and become more prone to infections or exacerbations. Emphysema occurs when the little air sacs, the alveoli in the lungs, become damaged. Normally, the alveoli inflate like balloons when you breathe in. When you breathe out, they deflate to allow the air to move out of your lungs. When you have emphysema, the alveoli become less elastic and are harder to inflate and deflate, and air can become trapped. It can become harder for you to breathe in and out. As the air sacs are destroyed, the lungs are able to transfer less oxygen to the bloodstream. This causes shortness of breath. What causes COPD? You can get COPD by being exposed to something harmful to your lungs for a prolonged period of time, resulting in the lungs becoming permanently damaged. The leading cause of COPD is smoking. Many people who suffer from COPD are current or former smokers. Unfortunately, passive smoking can cause it as well. Occupational causes are environmental factors such as dust, air pollution, or chemicals, and some inherited conditions can cause COPD. What are the symptoms of COPD? The symptoms of COPD can creep up on people, and it is often years before symptoms reach a point that makes you attend your GP. The main symptoms are persistent cough, where sputum is produced daily. This can be called a smoker's cough. You may have noticed recurrent chest infections during the winter months, or chest infections that take longer to resolve. Wheezing, where you yourself or family and friends have noticed noisy breathing at rest or during certain activities, like walking or getting washed and dressed. And breathlessness can be a daily occurrence for some people with COPD. In mild forms, it may be noted only when climbing the stairs, or in severe cases, breathlessness can be experienced dressing, washing, or eating. People with COPD can be more prone to chest infections because of the excess mucus produced, and the lungs provide a warm, wet environment for bacteria to grow. With COPD, all or some of the symptoms will be present. Further investigation will be required. How is COPD treated? The most important treatment is stopping smoking. If you have COPD and continue to smoke, the damage and your symptoms will get much worse. If you stop smoking, this will improve your cough, the mucus, and the rate at which you become breathless. Vaccinations, the flu vaccination, pneumonia vaccination, can help prevent infections that could make you worse. Medications used, and this includes inhalers, which are the cornerstone of your daily treatment, and incorporate bronchodilators or relievers, and steroids or preventors, and we will discuss these further. Antibiotics are used to treat bacterial infections. It is good practice, where possible, to leave a sputum sample in with your GP if recurrent antibiotics are required. This will ensure the bacteria present in the sample is not resistant to the prescribed antibiotic. Oral steroids, prednisolone, which is used to treat inflammation in the airways, causing increased wheeze and breathlessness. Mucolytics, these are used to break up the mucus and make it easier to expectorate. And oxygen. If the oxygen levels in the blood are low, then oxygen is prescribed after strict assessment, which includes blood and walking tests. Too much oxygen can be dangerous for someone with COPD. Inhalers used in COPD. Inhalers are the cornerstone of COPD treatment. There are two main groups: the reliever inhalers, which are bronchodilators, and these help widen the airways by relaxing the muscles around them. Bronchodilators can be either quick-acting, such as salbutamol, Ventolin, Salamol, and these act within 5 to 10 minutes to relieve breathlessness and last for 4 to 6 hours. These inhalers are usually blue in colour. Long-acting bronchodilators or controllers, such as Spiriva, Braltus, usually take about 20 to 30 minutes to act, but last 12 to 24 hours, depending on your inhaler. These do not relieve breathlessness immediately, but taken daily can reduce the symptoms. Steroid preventor inhalers work to reduce the inflammation in your airways and to make your flare-ups or exacerbations less frequent and severe. Preventor inhalers normally contain a combination of a long-acting bronchodilator and the steroid. The steroid works over a longer period and will not give immediate or quick relief when breathless. Preventor inhalers are usually red, pink, or purple in colour. Over the past few years, new inhalers have come onto the market. These include new combinations of bronchodilators and new triple therapy of bronchodilators and steroids in one device. These are normally known as Trelegy or Trimbo. Speak to your practice nurse, your GP, or your pharmacist if you are unsure which type of inhaler you are prescribed. Inhalers are very effective if used correctly. They are designed to get medication directly down into your lungs, to the narrow passages causing your symptoms. Ask yourself, what inhalers am I using? Am I confident that I am using them correctly? One of the main reasons why symptoms can be poorly controlled may be down to poor inhaler technique. If your inhaler technique has been checked by your practice nurse, GP, pharmacist, and is effective, but you are still symptomatic, then a change to another type of inhaler may be appropriate. There are two main types of inhalers. There's the pressured meter dose, and the action to deliver the medication is a fine mist, which you breathe in. The medication is released by pressing on the top of the inhaler or by activation by breath. It can be difficult to coordinate the actions needed to use meter dose inhalers, i.e. taking a breath and pressing on the canister. A spacer device can be a great addition as it is easier to hold and you are able to breathe in and out much easier several times from the chamber. This is beneficial, especially if you are breathless and find it difficult to coordinate your breathing. A spacer also reduces the amount of medication that is absorbed in the mouth and the throat. A greater percentage of the drug is able to reach the narrow airways of the lungs where it is needed. Dry powder inhalers. In dry powder inhalers, the likes of Spiriva, Duoclear, Anoro, Symbicort, etc., the medication comes in a dry powder, either stored in capsule, which you load into an inhaler, or the inhaler is already pre-filled and you load the dry powder by opening the lid. A dry powder inhaler requires you to breathe much faster and deeper to allow you to suck the powder in. Some people can find this difficult to do. Some inhalers will have a gauge or counter to allow you to know if you have managed to activate the drug. If you taste a lot of dry powder on your tongue or back of throat, then the medication is not reaching the lungs where it is needed. It is very important that you rinse your mouth out well after all dry powder inhalers, so as to prevent additional problems such as oral thrush. Using your spacer. Shake the inhaler well. Fit the inhaler into the spacer at the opposite end of the mouthpiece. Breathe out and empty your lungs. Put your mouth around the mouthpiece, making sure there is a tight seal. Spray one puff into the spacer. Breathe slowly and deeply, 4 to 5 breaths, and then hold your breath for 5 to 10 seconds. Remove the spacer from your mouth. If a second dose of your inhaler is prescribed, wait 1 minute and repeat all steps again. When finished, rinse your mouth out. How to use dry powder inhalers. Some dry powder inhalers require a capsule to be loaded or lid to be opened to load the drug. Check your inhaler. Make sure you're sitting upright in a comfortable position. Breathe out, emptying the lungs of air. Put the mouthpiece into the mouth and seal the lips. Take a hard, fast breath in and hold for 5 to 10 seconds. Breathe out slowly. If a second puff is required, repeat all steps again. Rinse mouth out well after taking the inhaler. Using a metered dose inhaler. Always make sure you're sitting upright before taking any inhaler. Shake the inhaler well. Breathe out to empty the lungs. Put the inhaler into the mouth and seal lips around the mouthpiece. Whilst pressing down on the canister, take a steady, deep breath in, filling your lungs. Hold your breath for a count of 5 to 10, as much as you can manage. Breathe out slowly. If a second puff is prescribed, wait 1 minute and repeat all steps again. Rinse mouth out well after any inhaler. Maintenance and cleaning of inhalers. For all inhalers, wipe the mouthpiece after each use and replace the cap or close the lid. Always keep the device closed, at room temperature, in a dry place and protect from humidity. Keep capsules in their original packaging until use. Never immerse the inhaler in water or exhale into the inhaler, as this will cause the device to malfunction. Any spacer device needs to be washed as per manufacturer's instructions, usually once a week, and air dried. Your spacer, if kept in good condition, can last 1 to 2 years, depending on the type. Check with your practice nurse or pharmacist. Nebulizers. A nebulizer is a mechanical device which turns a solution of medication, usually a bronchodilator, into a vapor or a mist, which can be inhaled. Nebulizers need to be prescribed by a doctor or respiratory nurse specialist. It is a much higher dose of drug and can't have side effects. Nebulizers are prescribed where people are unable to manage inhalers or their condition has deteriorated. The benefit of a nebulizer needs to be monitored. Nebulizer equipment should never be shared between patients, and mouthpieces and tubing needs replaced regularly. Thank you for listening.